Hello everybody, Dr. Randy Wurts in Thrive Chiropractic. Hey, chances are that if you're watching this video, you probably have pain running down your leg. Maybe so severe that you can't stand it. It might even be going into the feet. This is something we call sciatica. And it gets its name because the nerve that is running down the back of the leg, down into the hamstring, is actually the sciatic nerve. And what happens is you'll get irritation in your low back. Now, or in your muscles. So there could be different causes. A disc issue in your low back can cause sciatic problems, and it shows up down the back of your leg. A misalignment in your hips can irritate the disc, and those will cause issues with your sciatic nerve as well. The sciatic nerve actually is composed of like 5 different nerves in your low back. So you have irritations with any one of those, it can cause issues with sciatica down the back of your leg. So even muscle spasms, if you're running a lot, or in your butt, will cause issues with those. So here's some tips that I'm going to give to you that you may be able to dampen this a little bit and give it some time to heal. So I think rest is very important with this, because the more you work and the more you injure it, the worse it's going to get and the more inflamed it's going to be. So stretching can be very important, especially if it's muscle. Now, if you do stretch and it gets worse, you stop right away, because that's going to irritate it more than anything, and there could be something else more severe that's going on. So stretching would be good. Now, when I say by stretching, you can actually put your leg, when you're sitting down, I'm going to do it standing up, put your leg up like this, and you're sitting down and you're leaning over. And I believe I have some videos on this as well where you can stretch. So you're almost like when you're sitting down, you're putting your ankle up over your knee, and then you're kind of just leaning forward. Or when you're laying on your back, you can pull your knee up to the opposite shoulder and leave it held. And it might feel very tight in your butt for a while, for like 30 seconds to a minute, but that's going to help get the muscle spasm moved out. Ice is something that you can do too, especially if it's a disc issue, because you put a half a bag of ice, a gallon bag of ice, and you put water, a half a bag of water in it. It makes what we call a slush bag. Put that directly on your skin, and I know you're not going to like me very well, but it does help. And a lot of people I've given this to, they say it does help. It eases the pain for a little bit, and it gets the inflammation out. But then after that, what I advise people do is get up and walk. You need to get up and walk, because if it's a disc issue, in this case, you're going to know right away if it's going to start hurting. If it's a muscle, you stop right away. If there's any indication where it gets worse, you just stop right away. That's when you need to see a doctor at a consult. But if you're having some issues with the sciatica, icing and then walking nice and easy for about 2 to 3 minutes, just nice and easy, gets the disc moving again. It gets the inflammation out with the ice, and then getting the walking will help get the blood flow moving back again as well. Hey, but what if there's a way that you found out that, hey, maybe you can prevent this sciatica? Obviously, keeping your hips lined up, that's a big thing. Protecting your back, lifting correctly, those are all big things as well. But I'm talking about, hey, if there's some other symptoms that are kind of keying you into something's not right, I'm going to let you know. And those speed bumps, or what I call them, are when you start to get numbness in your foot in any case. Okay, so if you start to get numbness in your foot, that can be an issue, an indication that you may have sciatic problems that are starting to appear. So if there's any other issues, like your legs getting warm or really hot, really tender to the touch, swelling up, it's a blood clot. You get to the hospital right away. You don't belong in any other place besides a hospital. So if you start to get numbness in your feet, that's an indication of it's a little bit of a nerve issue. If you start getting cramping in your feet, particularly one side more than the other, I've gotten this from time to time, and I get, okay, what's going on? What do I need to check? So I'll get cramping in my calves, and it's an indication, hey, something's not right with my nerves. I got to go get this checked out. If you have past low back pain and you're starting to feel this numbness, a good indication that sciatica is not too far around the corner, and it might just be a matter of picking up a pencil on the floor, your back goes out, and boom, you get the pain burning down your back of your leg. It can also be down now. You can also have pain down the front of your leg, and that's an entirely different nerve, but it can be issues the same thing. That's the femoral nerve that runs right down the front of your thigh. It's just you're misaligned in a different way, and your bones aren't working correctly, and the joints aren't working, affecting a different part of the nerves. So if you have any question on any of this, give me a call, give me a jingle. Be happy to help you in any way. And again, if some of these aren't clearing up, maybe now is the time to call a chiropractor, see what they can do to help you. Take care. Bye.